Next tonight, the winter crisis is being blamed for one of our hospitals recording its worst ever waiting times for A&E patients. Nottingham Hospital's NHS Trust says unprecedented demand has led to only 75% of patients being seen within the target time of 4 hours.
Well, the figures have been released during a demanding period which has seen many hospitals declare major incidents, postpone operations and call in more staff to cope with the pressure.
The number of patients attending A&E across the East Midlands has risen dramatically, with all our hospitals reporting acute demand and all of them failing to meet waiting time targets. Sarah Teal's been looking at the figures.
It's been the busiest winter on record for our hospitals, and figures released by NHS England back that up, showing an 8% increase in patients attending A&E and minor injury units across the East Midlands in the first week of this year compared with last year. That's more than 1,100 extra patients who have been seen. And that increase in demand has had a severe effect on waiting times. Every hospital in our region failing to meet this, the target of seeing, treating and either discharging or admitting 95% of patients within 4 hours. You can see how the trusts have performed here, with Nottingham only treating 3/4 of patients within that time frame. That's dramatically down on the same period last year and is the worst performance recorded since the target was introduced in 2010. All of our other hospitals failed to meet the target too, with figures much worse than this time last year. Hospital bosses are blaming the longer waiting times on unprecedented demand.
Well, the whole system is facing a lot of pressure. It's not just A&E. A&E is the pinch point, but we have to accept that every part of the system is working very hard, and our staff are working very hard to deal with the patients and make sure they get effective, timely and safe care. So the whole system is running at maximum capacity, and as a result of that, the A&E waiting times have increased slightly.
A&E departments across our region are suffering a crisis. We're seeing increased numbers of people who are attending A&E, and when they do, they're having to wait longer. We're hearing stories of people having to wait outside, people waiting on trolleys. There's a very significant problem in our A&E departments, and the government need to get a grip.
I could talk to you till the cows come home about the billions of pounds extra that this government has spent on the National Health Service, but what counts is a local delivery. And if we can persuade individual citizens, individual patients, first of all, not to clog up the A&E system if they really don't need to, either wait to see the GP or go to the walk-in centre.
Well, Sarah's with us. Brings up to speed. What's the situation now with our hospitals?
Well, Nottingham hospitals have apologised to any patients who've experienced delays. They say they've implemented their internal incident plan to try and manage that demand. Derby Hospital said this has been their busiest December since records began, but they're beginning to see some improvement in waiting times. And Leicester Hospital said they're doing everything they can to speed things up, but they told us it's likely these pressures will only increase from now until March. Well, NHS England agree with that, and they're blaming the flu. They say it's at its highest levels since in 3 winters, and they're urging anyone who hasn't had a flu jab to go and get one, even at this late stage.
OK, Sarah, thanks very much indeed.
Thank you. Still to come in sport, we're with the Gentle Giant goalie who has just joined Leicester.
Yes, Chelsea's Mark Schwarzer has swapped the top of the Premier League for